Good day, guys. I have a funny experience to share with you. A man reached out to me some years ago. He has adenosospermia, meaning he has low sperm counts, and none of his sperm cells are alive. Like there are sperm cells, but none of them are alive. They are all dead. So I make further findings to get to the root cause of the matter. Then afterwards, I prepare some herbal regimen for him, which is meant to be used for 2 months. After the end of the 2 months period of using the herbs, I told him to go for another semen analysis test, that is to check the progress of the treatment. So lo and behold, the test result shows that his sperm count has skyrocketed to 120 million. In fact, the WHO standard is 39 million, but now the man have 120 million. That is times three of the average quantity of the sperm cells, and also 80% of the sperm cells are alive. Just 2 months ago, none of the sperm cells are alive, but after 2 months of treatment, it became 80%. Now, the funny part of it is that when this man sent the test result to me, then he said, can I believe that he have been treating this condition for the past 3 years using orthodox medicine? Like he's been going to hospital, he's been giving series of drugs and series of procedures have been done on him, and there's no result. So he now said his doctor told him straightforward that, man, don't use ado, don't use herbs, oh, don't mind all this about this thing, oh, don't worry, these drugs will work. And he's been using the drug for like 3 years, and in fact, it's affecting his home, and that's why he's like, let me try herbs. At least there's nothing wrong in trying. So, and within 2 months, the sperm count skyrocketed to 120 million, and 80% are alive. So he went back to the hospital to meet that same doctor. And when he got to the doctor and showed him the new test results that shows the current level of his sperm cells and motility level, the doctor was like, you see the drugs I gave you work? He said, no, it's not the drug. I use herbs. He was like, herbs? She might say, make you not use herb. I said, you should not use herbs. He's like, you said I should not use herbs? I've been using drugs, I've been spending money, so many procedures, so many tests and everything have been done, and there's no result, and you don't want me to go for herbs. Then I went for herbs out of your own wish within just 2 months. Look at the test results. So instead of the doctor should now be humble enough, you've seen results, you've seen the testimony, this is live. This is not maybe someone just cook up some result, and it is your patient. You've been treating the patient and you know the condition that the patient's sperm count is. Then the patient came with a new test that shows that the sperm counts have improved the quality and quantity. Then instead of you to be humble enough to okay, who is this person? How can I reach out to him so as to help my? In fact, this my patient told me that this doctor treating him also have the same exact condition. Like he also has adenosospermia. This doctor did not have a child of his own because his sperm count is low. I mean, the medical doctor. This is what my patient told me. He said the doctor himself told him that this thing where they do you, they do me too. This thing affecting is affecting me, and this is the drug. Like he's giving him the same drug that he is using. The doctor is not seeing results. The man too is not seeing results, and the doctor still tells the man that aluta continua, keep on using it. Now your patient have used herbs, and within 2 months, the result is clearly, the evidence is very clear. Instead of him to be humble enough to ask that, Mr. Man, link me with this guy so that he can help me also, because he's also having the same condition. He doesn't have a child of his own. The doctor was like, he won't use herbs on his own. He won't use herbs. I would rather keep on using these drugs, even if it did not work. Like I was like, should this enmity reach this level? Like you don't have a child. What kind of bigotry is this? You have a condition and you've seen someone else that have the same condition and the person got treated, and you are still insisting that you do not believe that it will work. Like before the advent of these conventional medicines, what have your fathers, your grandfathers, thousands of years before, what have they been using? Yes, herbal medicine has its strength and weakness. And the same thing with conventional medicine. It has its strength and weakness. But the best approach to go about it to ensure that the patients, they get the best results is for you to integrate the two medicine practice, where you integrate the strength of natural medicine with the strength of conventional medicine. So this will get you the best result for your patients. But you don't really care But you don't really care about your patient, because if you care about the patient, the results will be what you prioritize. Like, you're telling the patient not to use something, and the patient used it and it works, and you're still like, no, you won't use it or you won't recommend it because it is against your own practice. Who owns such practice? Who owns such kind of principles and ethics? The end goal of treatment is to get your patient treated, get results. That's the end goal. So you, as a healthcare provider, don't be a bigot. Learn how to integrate the strengths in both treatment modalities, in natural medicine and conventional medicine, and this will ensure that you get substantial treatment and success for your patients. Thanks so much, the Criterion Cares.